So that is what this is about, celebrating frontline workers. Head of Health Desk, Fred Smith, who's also producer for this program, is here in the studio with me. Fred, it's good to have you.
Yeah, good to see you.
All right. So tell us about Frontline. For people who are watching us, what do we want to communicate with this?
Well, in the light of the outbreak in Ghana, we realized that the most important people in fighting or dealing with the outbreak of this disease would be the persons who first have to go close to the patients, support them in whatever way possible, and help them to recover. Some don't recover, some succumb, but we know that they give up their very best. They sacrifice their own safety to be there. And as we've heard from some of them, they even lack the protection that they need in doing this job. And so we think that for people to be this brave in helping the nation deal with such a huge crisis that we have, they deserve to be celebrated. They are people we should be encouraging so that they can give off their very best. And there's no better way than to urge everybody through this our medium, JoyNews, on Pulse especially. We are free to air as well, so a lot of people can watch us and send a message of goodwill to our frontline workers. It's like we are at war. This war doesn't require a weapon, like a gun. You need our doctors and nurses to go with the needles and whatever health tools possible, so they can go and fight it. If you have a gun, you still cannot kill coronavirus.
Certainly. Isn't that strange? I mean, this is a virus that's keeping us in our homes, a virus that's changing the way we live, and with all the armory that you may have. It is actually
the virus, a disease which has got ISIS and other terrorist groups to stay at home. So it's a very serious matter. So for someone to take the risk that I'm going to the front line to deal with them, it's not been confirmed, but I'm even getting information that some persons who work at the airport, frontline workers, have actually tested positive. We pray that it's not true, but if it turns out to be true, it will be bad for us. We've heard the case of Lekma, where a senior officer there has also...
And imagine this, Fred. Here is a doctor who is working. I mean, this is his job or his or her job. They wake up, this is all that they have to do. And you go there, and in the quest to save a life, you end up endangering your life. And so now he can't probably get close to his family.
Indeed, a situation at the hospital in Accra last week. That some people came there. They didn't realize early enough. They came through OPD. They were taking care of them. The nurses were touching them, checking their temperature, and doing all sorts of things for them. Until at a point when the doctors had also, attended to them, that they realized they were exhibiting symptoms of coronavirus. At this point, when they realized they met the case definition, it was just too late. All of them had been exposed.
They had to be quarantined.
Yeah, to this. They had to be quarantined.
And so imagine that you don't tell the truth. You don't give the right information when you go to the hospital, and you expose yourself to you expose all these nurses and doctors to COVID-19. Who is going to take care of you when you are sick?
It will reduce the numbers. You recall that at the Greater Accra Hospital, they put some doctors in quarantine. It's because they had been exposed, and during this period of quarantine, they won't be available for us. We know that we don't have enough. As many health professionals as we need. So the health ministry has had to actually call those who are on leave and having to do, those who are doing other things, to come back to work. And so if you still expose them to this, it's a problem for us. So that's why we want to have this platform to, encourage them, say nice things for them, let them know that we are behind them in this war.
And then we will stay at home when we're told to do so.
As a matter of fact, there's one I spoke to She is the Deputy Director of Nursing Services, Gifty Abankwa.
Okay. Before we come to her, though, Fred, I think that one of the biggest cases that we've had today, as far as those are the front line is concerned, is the LECMA situation. Let's take a look at this the LECMA situation, and then we'll come back to that. Well, authorities of the LECMA hospital have isolated patients who shared the same ward with one of their doctors suspected to have contracted COVID-19. Municipal Health Director of LECMA, Jacqueline Lamy, told Captain Smart of our sister station Adom FM that the patient has since been referred for further testing and examination.
Yes, the doctor has confirmed positive in the hospital. It was not confirmed in the hospital. It was confirmed somewhere else.
It was not confirmed in the hospital?
No.
Somewhere
it was confirmed
else.
Somewhere else.
Is it here in Accra or any other part of the country?
Here in Accra.
Here in Accra.
Yes,
okay. When was this?
That was last week. We got the report last week Friday.
You got the information last week Friday?
Yes, please.
And I don't know, even between the time you got the information, whether he was coming to the hospital and attending to patients?
No, he was not.
He was not?
No, he was asked to do a national takeover for his management as a protocol.
Okay, so he'd never visited the hospital after he was tested positive?
No, he hasn't been to work.
But I know
at that point, the protocol, he's supposed to go into the treatment center, and that is what he's doing.
You would have a better and fair idea about health than some of us. We're told that the gestation period is between 3 and 14 days. So between the time he was tested positive, where was he?
He was at work.
He was at work?
Yes.
Have you started anything to find out from the people that he got in contact with?
Yes, please. As soon as we found out that we got a report that he was positive, measures were put in place to protect both the staff and the patients that he came in contact with. And we started doing that on Friday. So those he came into contact with, that is his contact, were informed and they were asked to self-isolate. And so they've all gone into self-isolation or quarantine. And as protocols say, we are also doing contact tracing. We are following them up for the next 14 days to find out if they develop any symptoms of COVID-19. And the patients that he dealt with, they've also quarantined them. They are tested. All the staff and patients were also tested before they were asked to do them. So we did those tests on Saturday, Sunday, and some yesterday. The patients that were sick on the ward, those that were stable, were discharged, and so that we can we could empty the ward and have it fumigated today. And the place will be fumigated and will be vacant for the next 36 hours before we can have access to those wards.
Captain Smart there speaking to a doctor, LECMA, there, who is confirming that one of the doctors there has tested positive to COVID-19. Fred Smith is still here with me. Fred.
Well, Gifty, so we will hear from your namesake, Gifty Abankwa, Deputy Director of Nursing Services, who's been sharing with us how nurses and other health professionals, the doctors, are coping in the light of this difficult period.
All right.
Not easy. We are coping because we need the logistics to be able to prevent us from even getting it and be able to help those who are ill. So these things will go a long way to help us, because sometimes the nurses don't even want to go towards the patient because they are scared. But if you don't get the masks, you don't get the gowns, how do I have confidence in nursing such a patient? Sometimes I have to give him medicine. I have to bath him. I have to help him to paste. But I don't have the mask. Hey, I don't have the gown. So indirectly, if we have those logistics and we have it, we are able to help. And sometimes when you go home, you can't even get near your relatives. They said, hey, are you bringing some of the condition? So we start removing our shoe outside, putting our things outside, just enter into the bathroom before you even come close to them. So these are some of the challenges we are having.
I see. And for the patients, you'd have to do things you mentioned. You have to.
Those who are very ill, who cannot do it, but those who can, we assist them.
But you have just 4 of them here.
Yes, 4 of them here.
Okay, and some of them need
care. So there are some nurses separately there, both nurses and doctors taking care of them.
Okay. And they provide assistance such as helping them take their bath, and also
those who are very ill. But those who can, we just assist them, encourage them.
So how many are in this condition?
4.
For how many of them are in this condition who would need some support to this?
Most of them are not very ill. I can't really figure because I'm really not there. Because we want to limit the exposure. So most of the time, we always have to go and hear from them. But some are rushed into the emergency. You can't tell. Some are on the point of death, so they are rushed in. So indirectly, you have to be armed. So if you don't have such a thing, how do you come near the person? Some of them, they can't breathe. Others come. The symptoms are there. Sometimes they are not. So they have to do a lot of labs and things. And if you see that, we have to call somebody to take the sample. If it's positive, then we know what to do. If it's negative, then we know what to do. We have a holding bay. When you come, you can go there. They will assess you. They will interview you. If you fall into the WHO category, fine, we take the sample. If the results come, we decide what to do. Either we send you to the bay. If the place is full, we have to arrange for you to go to the nearest place to get the care.
Okay, you're doing a good job for Mother Ghana. Congratulations.
So give us moral support. Because sometimes sitting in the trotro and even when you hear going near the patient, it's pathetic. Because you need the patient needs care. But if you don't have the gadgets, how can you? Because some nurses have got, some doctors have got it.
Over here?
Not here.
But somewhere in the country?
Somewhere in the country. And they are being quarantined. You can't go back home. Yes, if you are positive, you can't go back home.
Now already, if you are a health worker, for example, going back home, it comes with a lot of uncertainty. Even if you've not tested positive in these times, going back home comes with a lot of uncertainties. You don't know, should I touch my son? Should I touch my wife? Should I touch my spouse? First Smith, it looks like a very difficult situation, but we're here.
Yes, and she makes the point that even after work, they are concerned about those who don't have their own vehicles and have to join the public transport. They are concerned about joining people because then if you've contracted any disease, you would pass it on to the others that you use the vehicle with. And when you get home, she said that they even have to take off their footwear outside, their shoes and the rest outside.
Okay, should we also leave our footwear outside? I mean,
well, we are not in the same situation as they are.
So they operate in the hospital where they are much more exposed.
Yes, so they are very exposed and they have to take their bath before they can even talk to anyone at home and the rest. It's not a way. We know that when you are returning from work, your children, your nieces and the rest will want to come and say, closer. Oh yeah, welcome Mami you, hello, Mami Odende, that kind of thing. That's our culture. But the nature of their job is changing all of that, and especially the threat posed by COVID-19. And so that's why they need our encouragement to continue doing what they're doing. It's not easy at all. And to think that some of them actually are not even not being properly remunerated, it's really, really painful. I've had an argument with somebody who's supposed to respond to COVID cases who was showing some lackadaisical, attitude.
I know,
And my concern, I was unhappy with the person, but I realized after the argument with this person that they've not been paid.
Well, that's what the person said.
That's what the person claimed. They've not been paid. Those who are supposed to be doing contact tracing, they're going close. If you've not been paid, how do you go and do all of these things? And we keep getting calls from frontline workers complaining that we don't have this, or we've not been paid, or we've not been given this or that, one thing or the other. So put all of these things aside. I think that's work for government to do. But for us, the little we can do is to say Ayiko and thank you for the little that you're doing to support all of us. So because of that, we have some of our colleagues saying this Ayiko in the first edition of Frontline, and we can hear them now.
We are at war with the coronavirus pandemic, and our frontline has soldiers who don't carry arms, they don't use tanks, they don't even use swords. They wear gloves. They are our doctors, our nurses, our healthcare professionals who treat us every day at the hospital. These are people who put their lives at risk every day that they scrub and they go to work. We just want to tell you that we support you. We appreciate every effort that you make. We appreciate the fact that you put your life at risk, you put your family's life at risk. We appreciate the fact that some of you have had to take time off your time with your family and go to work. We appreciate you, we love you, we support you, and we will do our part in this war by washing our hands, by maintaining a good social distance, and by staying at home. Thank you.
My name is Raymond N.D. Labi, Human Resource Shared Services Manager of the Multimedia Group. I want to send out a message of appreciation to all those at the front line of this fight against COVID-19. As a human resource person, we believe that the people are the most valued asset of any enterprise. And it is they who make a difference at all times. In these challenging times, we believe those at the forefront of this fight, the nurses, the doctors, the cleaners, the security officers, the drivers, the technicians, will come out and come out glorious when the battle is over. It is a difficult time for them, but we want to urge them on to remember the oath that they have signed on to know that all Ghanaians are behind them as they fight to get this out of Ghana and the entire world.
I'm Winston Amwa, and in these times we can understand the challenges that as frontline workers you go through, particularly because of the unavailability of so many PPEs. But we also do appreciate how many of you have put yourself on the line and how many of you are helping us to cope or are helping us to defeat the coronavirus. We can only appreciate you and say thank you so much and applaud you for the good work that you're doing for Mother Ghana.
My name is Benedict Usu. I'm a sports journalist here at the Multimedia. The frontline health workers are already doing an amazing job. I mean, we are in trying times and it's not been easy, but we just want to encourage them to continue the good work they are doing. We know we'll all come out of this sooner or later, but we all pray that it will be sooner. And I would want to use this platform to encourage them to continue the good work that they are doing.
I'm George, the junior sports journalist here at Multimedia. I know it takes a lot of bravery to be right on the battle lines. Frontline health workers, aside doing their job, have to sacrifice a lot to be facing all these challenges and the fact that they could even get themselves ill as well. I think so far a great job has been done, knowing that we have so many challenges with the medical system. I think that they are doing very, very well. We encourage them to continue so we can all win this war together.
All right, so that's George Addo Jr. there. We're sending some warmth your way if you are working at the front lines of COVID-19. Fred Smith is head of our health desk. You may have heard him shouting. He's also producer of the show, so he was issuing some instructions out there. Fred, we're hoping that through this medium we'll get a lot of individuals who are staying at home to also commit to staying at home, and whilst they do so, bring in these messages that encourage our health workers. We just heard from the nurse who spoke to you the challenges that they go through, but hopefully with these messages coming through, their spirits will be lifted. What else do we intend to achieve with this segment?
Well, beyond the staff of Multimedia Group, we also encourage the general public to send short videos encouraging our nurses, doctors, and other professionals who are working at the front line, because it's not just the healthcare professionals, there are others who also deal with this. The community nurses and whoever will come into contact with a situation before the COVID case is brought to a conclusion. And so the things they need mainly, that number one, they want you to stay at home, first of all, as the president has asked us to do. Then you need to say a word of encouragement to them. You can do that via video because COVID doesn't like close contact or interactions. So if you send a video to us, the world will hear your message, and the nurses will get to hear it. And then if you have something you want to share with them, say, PPEs, you have gloves or nose mask or anything that will support their work, because that's one of the major things that they called for. That the whole world is struggling to provide. Indeed. Anyway. You can also share that so that we pass that on to them. I'm sure they will be very happy to do more of what they're doing already. Right. So, Fred, what is the situation, the Ghana situation right now as far as COVID cases are concerned? Well, the Ghana Health Service, the COVID page, dedicated COVID page, was updated today around 10:30, and it maintained the figures from yesterday. No improvements, well, no new cases. Okay. And so that's our situation. We still have 5 deaths and 2 recoveries on the website, but we know that the health minister has spoken to us and indicated that as many as 31 persons have recovered, and these persons will be heading home. That's great news for us. It's not on the website. Our sources are also telling us that our cases have significantly increased. That has also not been reported yet, and so we keep our fingers crossed as to when these cases are finally reported to us, and then we can share with the rest of our viewers. All right. Well, Fred, I'd like for you to stay with me whilst I take some of these messages coming through from our viewers. Says, we appreciate the selfless efforts made by our health couples to save our lives from Sami in airport states in Kumasi. I hope that you are staying at home, Mr. Sami there. Thank you very much for your message. This one says there's a group of youngsters patrolling the areas of Abosokai. Okay, you're saying that they're smoking weed. I don't know. Perhaps you want the police to take a look at that. He says, please help me inform the police to patrol this area if possible. So that is Gaskia bus stop at the Abosokai. He says there's something going on there that the police might want to turn their attention to. This one says, kudos to all our frontline workers. Indeed, God will surely be with them. Hashtag stay home, a good thing to do, and thank you for sending that message for them to stay home. This one says, you sent a video. I'm unable to play it at the moment, but we'll certainly play it. It says, to all frontline workers, I, Desmond Agbo, says, Aiko, we are with you in this situation. This too shall pass. God bless you all from Techiman. Fred, let's call it a wrap before you go. Any final words? Yeah, that's very encouraging. We'll still ask the public to share with us their messages, encourage our healthcare professionals who are dealing with this matter, and we also ask our governments to do all that they can. I know it's challenging for them as well. Our decision makers, they make the policies for our healthcare providers to implement. It's a difficult time for them. Yeah. Some of them don't sleep at all. Some spend the nights meeting with national security, going to brief the president and doing all sorts of things. So it's such a difficult thing. I've had a call from someone who had closed from a meeting so late, somewhere around midnight, and that was a briefing to the president. So it tells you what the president himself is going through, staying that late. Yes, he's the first frontline worker. Yeah, he's the first frontline worker. So yes, we appreciate all of them, our political leaders, everybody. We appreciate all of them, but we need to put in the extra effort to ensure that our doctors have the necessary protection to do their job. And it's really nice that you just said that, because I just got a message from someone who says she's a nurse. She says, we are nurses and we bought these PPEs with our own money. We know God will see us through. And they sent us a very beautiful selfie. I think there's 2 of them. I don't know. Maybe you'll be able to see. It says, oh, beautiful. But no social distancing, please. Right, I think you need to practice more of the social distancing from wherever you sent us this message. Thank you so much. Good work here. There it is. Good work you're doing there. Don't worry, nobody will see your face. But at least we see that you've sent us this. Frontline workers, thank you so much for sending this. But Fred, unfortunately, she says, look, we bought this with our own money. Yeah, so that's what we're saying. So people should support. If you have any way of getting PPEs to help them, let's do that. If you contact us, we'll receive any donation that you make and we'll pass them on to whichever institution that needs it.
We certainly won't touch it. We certainly will not touch it.
Yeah.
My final message is JoyNews. My name is Ibrahim from Savelugu. Please, I want you to interview frontline workers, especially all those in the regions, whether they have received their PPEs in order for them to do their work effectively and the challenges they are facing. Thank you for sending that message. We'll take a look at that one as well.
There's actually a validation going on because the president announced that they were distributing the PPEs and that anyone who has not, the information minister said at the last news conference that if you've not received, there will be a validation. You can call in and indicate that we don't have it. Then they will check whether your hospital has received and not passing on to those who are actually doing the job. And so all of that will be done. I'm sure the situation will improve significantly once that validation is done.
Okay, so the thing is, if you have not received it, you work in a hospital and you've not received it, the idea is that go through that validation process and let them know that you have not received your PPEs. Fred, thank you so much for coming and for helping us do this. This is JoyNews. This is the pause, I should say, but of course we've just introduced a segment, Frontline, and it is focused on celebrating our frontline workers. Indeed, I can even say I'm a frontline worker, Fred, right? We go out there, we interview people, and we get exposed.
We do, but they are actually the ones who touch the patients.
The patients. So certainly frontline workers, for all of you who are working hard, the police officers, the military officers, to make even this lockdown work, thank you so much. We're here. We've done. Your efforts are not going unnoticed at all. Fred, thank you. Fred Smith is head of our health desk, also producer for this program.